Robust partnership. Welcome to the Risk Communication and Community Engagement, RCCE, digital efforts. RCCE is at the center of all response pillars, connecting technical interventions with the people they are meant to serve. It acts as the bridge and glue among all response pillars, ensuring people-centered and effective outbreak response. Ethiopia joined the EIOS platform in 2023 and began active implementation in 2024 to strengthen digital media monitoring, enabling early signal detection and public health intelligence. To date, more than 27,000 articles have been reviewed, 97 signals have been identified, and 17 of these have been linked to PHEM. Since 2022, the hotline has received over 2.3 million calls, demonstrating strong community engagement. That Meekness, the call center, receives an average of 1,621 calls per day, 68 per hour, or more than 1 call per minute. It is one of the key social listening platforms, particularly during outbreaks. Various evidence products have been generated, particularly during outbreaks, to inform RCCE strategies and to develop standard and strategic documents that advance RCCE efforts as shown here. The Institute has planned these initiatives to further enhance RCCE digital efforts in collaboration with different stakeholders and partners. Thank you. Together, we strengthen RCCE for resilient public health systems. Welcome to the Risk Communication and Community Engagement, RCCE, digital efforts. RCCE is at the center of all response pillars, connecting technical interventions with the people they are meant to serve. It acts as the bridge and glue among all response pillars, ensuring people-centered and effective outbreak response. Ethiopia joined the EIOS platform in 2023 and began active implementation in 2024 to strengthen digital media monitoring, enabling early signal detection and public health intelligence. To date, more than 27,000 articles have been reviewed, 97 signals have been identified, and 17 of these have been linked to PHEM. The team conducts media monitoring using EIOS every other day and shifts to daily monitoring during emergencies. As shown in the video, the assigned person reviews published articles on EIOS and filters out important signals and information. The system has been expanded to the sub-national level since last year. All regions except one have started using the EIOS platform. The national hotline serves as the community feedback management mechanism, operating 24/7 with 41 skilled experts through an integrated call management system. The interactive voice response IVR system is also available in 5 languages for diseases of public health importance. Its aims are awareness creation, signal detection, and the collection of community concerns. Since 2022, the hotline has received over 2.3 million calls, demonstrating strong community engagement. That Meekness, the call center, receives an average of 1,621 calls per day, 68 per hour, or more than 1 call per minute. It is one of the key social listening platforms, particularly during outbreaks. Various evidence products have been generated, particularly during outbreaks, to inform RCCE strategies and to develop standard and strategic documents that advance RCCE efforts as shown here. The Institute has planned these initiatives to further enhance RCCE digital efforts in collaboration with different stakeholders and partners. Thank you. Together, we strengthen RCCE for resilient public health systems. Welcome to the Risk Communication and Community Engagement, RCCE digital efforts. RCCE is at the center of all response pillars, connecting technical interventions with the people they are meant to serve. It acts as the bridge and glue among all response pillars, ensuring people-centered and effective outbreak response. Ethiopia.
Welcome to PHEM Workforce Progress Update. The Public Health Emergency Workforce is one of the strategic focus areas of PHEM-Center of Excellence initiative, aiming to create skilled, adaptable, and fit-for-purpose workforce development system. The RRT, EMT, Evoke Surge are among the Surge team of Public Health Emergency. Our Rapid Response Team are multidisciplinary team across all levels fixed classification after successfully conducting full-scale simulation exercise in 2025. Since the establishment, they responded for Gofa landslide, Afar earthquake, and the Northern conflict. Since public health professionals are core members of any public health emergency response team, it is essential to strengthen the capacity of all PHEM officers through the Field Epidemiology Training Program. The FETP is a three-tiered training program comprising frontline, 3 months, intermediate, 9 months, and advanced, 2 years. The program aims to equip frontline professionals with the essential knowledge and practical skills required for surveillance, outbreak investigation, and emergency response. The ultimate goal is to ensure coverage of all districts in the country. One of the other initiatives to strengthen our surge capacity is Evoke Surge training program. Ethiopia is among 17 African countries implementing Evoke Surge in response to the growing urgency of public health emergencies across the continent. Since the program began in Ethiopia in 2023, 3 training cohorts have produced 304 multidisciplinary experts who have actively supported real public health emergency responses, including Marburg virus outbreaks. This surge capacity is designed to respond to emergencies within Ethiopia and beyond. Despite significant progress in strengthening our public health workforce, one critical gap remained: the absence of a comprehensive workforce information system. Today, we proudly launch a digital, trackable workforce management system. This innovative platform allows professionals to securely manage and update their own profiles, ensuring accurate and reliable data. On the admin side, the system enables real-time tracking of workforce capacity, geographic distribution, and evidence-based planning for effective deployment. Across the country, fragmented training and the absence of a standardized framework have long hindered our capacity-building efforts. Today, we proudly change that. The Ethiopian Health Emergency Corps, adapted and adopted from the Global Health Emergency Corps, will transform Ethiopia's public health workforce, strengthening the emergency workforce, expanding surge capacity, and fostering connected leadership. Through strategic investment in digitalization, capacity building, governance, and leadership, our goal is to build a competent, adaptable, equity-driven, and purpose-fit workforce capable of delivering timely, coordinated, and context-specific. International travel and cross-border movement connect people and bring economic opportunity, but it also carries public health responsibility. For many years, Ethiopia's border health processes relied on paper forms and manual verification. Information moved slowly, and coordination was difficult. Today, Ethiopia's travel and border health services are transitioning into a digitally enabled system designed to manage increasing traveler volumes and evolving health risks, seamlessly connecting vaccination, screening, and public health coordination into one continuous workflow. Digital health screening through electronic travel health declarations allows traveler information to be reviewed both before arrival and at the point of entry, supporting structured health assessment. By combining traveler information with on-site evaluation, health officers can prioritize attention where it is needed most. This approach improves consistency, supports high-volume traveler processing, and strengthens early detection of potential public health risks. When a traveler requires further assessment, information captured at the border supports timely investigation, referral, and follow-up. Travelers identified as suspected cases through health status alerts, observation, or thermoscanner screening are privately investigated through the Suspected Case Investigation stage in the tracker system. If isolation is required, a signal alert is generated in the Electronic Public Health Emergency Management System, enabling national public health teams to assume responsibility for further response beyond the point of entry. If not isolated but still needs follow-up, the line list is shared with the National Surveillance Call Center to be utilized for potential suspected case follow-up until the incubation period ends or the traveler leaves the country. The journey begins at international travelers' vaccination centers. Travelers are electronically registered and vaccination information is recorded at the point of service where the services are delivered, creating accurate and reliable vaccination record that supports both service delivery and future verification. Electronic certification improves efficiency for travelers while ensuring that vaccination information remains available for future verification and public health use. The digital certificate also had information, including the provider's name, strengthens both service delivery and accountability. At points of entry, vaccination certificates are verified instantly through secure QR scanning. Health officers quickly confirm validity of the health documentation, enabling smooth traveler movement while maintaining strong public health protection. When documentation is incomplete, travelers are guided through clear next steps based on established procedures, ensuring compliance with international health requirements while minimizing disruption to travel and trade. Digitized travel and border health services transform operational data into actionable insight. Information from vaccination services, traveler screening, and follow-up activities supports monitoring, planning, and preparedness. By linking points of entry with national public health systems, Ethiopia strengthens cross-border surveillance while supporting safe international mobility. From vaccination to verification, from screening to national coordination, digitalization is strengthening Ethiopia's ability to prevent, detect, and respond to public health risks at its borders. Before 2017, the Ethiopian Public Health Institute had scattered emergency supply chain practices and was mainly partner-dependent. The emergency supply chain operations weren't aligned with incident management system activation protocols. This led to fragmented responses and no clear roadmap for stockpiling life-saving supplies. In addition, we lacked legal framework and the infrastructures to move fast. Recognizing this, EPHI and partners conducted a landmark landscape assessment in 2019. It was a turning point, identifying exactly where we were and where we needed to go. The National Public Health Emergency Operations Center was established in August 2017 to respond to an acute watery diarrhea outbreak. Since then, the logistics function has become a backbone pillar of our emergency response system in managing the humanitarian needs of displaced populations to Ebola and cholera outbreaks, from the relentless demands of the COVID-19 pandemic to responding to conflict-induced crises and malaria outbreaks. In the process, our emergency supply chain has evolved. Why is emergency supply chain management so vital? Because in a crisis, emergency supply chain management is about real-time response to infectious diseases and humanitarian needs. It needs to mobilize resources instantly, a rapid procurement system, and a workforce trained in the specialized art of emergency supply chain. Because demand is unpredictable, our preparedness must be absolute. Our strategy is aligning every emergency supply chain function with the 4 phases of emergency management cycle: mitigation, preparedness, response, and recovery. We recognize that gaps still exist for better stockpiling of essential drugs and for reaching remote areas when infrastructure is limited, and on delivering protective supplies for healthcare workers. We've moved past the days of generic training. Today, we are on building a specialized emergency supply chain workforce. EPHI has invested heavily in development of frameworks, product list manual, and training manuals. As a result, over 450 logistics and supply chain officers have now completed basic emergency supply chain training. We are seeing a new era of commitment, where professionals are building their know-how in humanitarian resilience. Our emergency supply chain framework has 3 critical pillars: people and process, covering everything from governance to data visibility; commodity planning, the science of forecasting and sourcing; logistics and transport, ensuring that from the warehouse to the waste site, every move is calculated and efficient. To respond faster, we are on optimizing our warehouse operations, starting with dedicated emergency stores at EPHI for rapid response items. With 3 mini-stores already active and a massive new facility under construction, we are scaling up our capacity to meet any outbreak head-on. Every year, as public health emergency management, we conduct a comprehensive forecasting exercise aligned with our risk assessment and National Emergency Preparedness Plan by bringing together multidisciplinary experts and program managers. When an emergency is declared through Incident Management System, our Rapid Response Protocol kicks in. We assess readiness and map stakeholders. We mobilize resources and activate technical working groups. Most importantly, we aim for distribution within 24 to 72 hours, from expert deployment to stock monitoring. We've come a long way, but the journey continues. Our main focus areas are to digitalize our emergency supply chain, strengthen our emergency supply chain frameworks, develop emergency supply chain workforces, performance assessment, and develop emergency procurement guide so that we build a responsive and more resilient supply chain for emergency preparedness and response in Ethiopia. Before 2017, the Ethiopian Public Health Institute had scattered emergency supply chain practices and was mainly partner-dependent. The emergency supply chain operations weren't aligned with incident management system activation protocols. This led to fragmented responses and no clear roadmap for stockpiling life-saving supplies. In addition, we lacked legal framework and the infrastructures to move fast. Recognizing this, EPHI and partners conducted a landmark landscape assessment in 2019. It was a turning point, identifying exactly where we were and where we needed to go. The National Public Health Emergency Operations Center was established in August 2017 to respond to an acute watery diarrhea outbreak. Since then, the logistics function has become a backbone pillar of our emergency response system in managing the humanitarian needs of displaced populations to Ebola and cholera outbreaks, from the relentless demands of the COVID-19 pandemic to responding to conflict-induced crises and malaria outbreaks. In the process, our emergency supply chain has evolved. Why is emergency supply chain management so vital? Because in a crisis, emergency supply chain management is about real-time response to infectious diseases and humanitarian needs. It needs to mobilize resources instantly, a rapid procurement system, and a workforce trained in the specialized art of emergency supply chain. Because demand is unpredictable, our preparedness must be absolute. Our strategy is aligning every emergency supply chain function with the 4 phases of emergency management cycle: mitigation, preparedness, response, and recovery. We recognize that gaps still exist for better stockpiling of essential drugs and for reaching remote areas when infrastructure is limited, and on delivering protective supplies for healthcare workers. We've moved past the days of generic training. Today, we are on building a specialized emergency supply chain workforce. EPHI has invested heavily in development of frameworks, product list manual, and training manuals. As a result, over 450 logistics and supply chain officers have now completed basic emergency supply chain training. We are seeing a new era of commitment, where professionals are building their know-how in humanitarian resilience. Our emergency supply chain framework has 3 critical pillars: people and process, covering everything from governance to data visibility; commodity planning, the science of forecasting and sourcing; logistics and transport, ensuring that from the warehouse to the waste site, every move is calculated and efficient. To respond faster, we are on optimizing our warehouse operations, starting with dedicated emergency stores at EPHI for rapid response items. With 3 mini-stores already active and a massive new facility under construction, we are scaling up our capacity to meet any outbreak head-on. Every year, as public health emergency management, we conduct a comprehensive forecasting exercise aligned with our risk assessment and national emergency preparedness plan by bringing together multidisciplinary experts and program managers. When an emergency is declared through incident management system, our rapid response protocol kicks in. We assess readiness and map stakeholders. We mobilize resources and activate technical working groups. Most importantly, we aim for distribution within 24 to 72 hours, from expert deployment to stock monitoring. We've come a long way, but the journey continues. Our main focus areas are to digitalize our emergency supply chain, strengthen our emergency supply chain frameworks, develop emergency supply chain workforces, performance assessment, and develop emergency procurement guide so that we build a responsive and more resilient supply chain for emergency preparedness and response in Ethiopia. Before 2017, the Ethiopian Public Health Institute had scattered emergency supply chain practices and was mainly partner-dependent. The emergency supply chain operations weren't aligned with incident management system activation protocols. This led to fragmented responses and no clear roadmap for stockpiling life-saving supplies. In addition, we lacked legal framework and the infrastructures to move fast. Recognizing this, EPHI and partners conducted a landmark landscape assessment in 2019. It was a turning point, identifying exactly where we were and where we needed to.
room is on fire. My heart's beating louder. Black keys, white keys, best friends understand. Talking about it, never hide anything. This room is on fire. My heart's beating louder. This room is on fire.
Distinguished guests, thank you for waiting and for enjoying your moment here in the hall. And the guest of honors are coming in the hall now. And yes, please, let's rise up and let's welcome them to the hall. All right, so while we're still standing, we'll play the Ethiopian Federal Police March Band will play the Ethiopian National Anthem. Let's wait and እንጠብቃቸው እስኪገቡ እንግዶቻችንና የኢትዮጵያ ብሔራዊ ሕዝብ መዝሙር ይዘመርልናል። የኢትዮጵያ ፌደራል ፖሊስ ማርሽ ባንድ የኢትዮጵያ ሕዝብ መዝሙርን ይጫወቱልናል። Your Excellencies, ladies and gentlemen, thank you for joining us this morning. And now the march band will play the Ethiopian National Anthem. በጣም እናመሰግናለን። እባካችሁ ቦታችሁን ያዙልን። Thank you very much. Please take your seats. Ethiopian Federal Police March Band በጣም እናመሰግናለን። The session will be live streamed, so on Facebook, on Ethiopian, on EPHI, and on YouTube on World Health Organization Afro, WHO Afro, so you can share it with your contacts so that they can follow the whole thing. My media colleagues, are you ready? All set? Njammer? Good morning and welcome. እንዴት አደራችሁ? እንኳን ደህና መጣችሁ። Your Excellency Dr. Mekdes Daba, Minister of the Ministry of Health of the Federal Democratic Republic of Ethiopia, Dr. Mesai Hailu, Director General of EPHI Ethiopia, and Deputy Director Generals of EPHI, Your Excellency Dr. Wissam Mankula, from African CDC, Regional Director for Northern Regional Coordination Center, Your Excellency Professor Francis Kasolo, Country Office Representative of WHO Ethiopia, Susnadi, Deputy Director of Gates Foundation Ethiopian Office, Mariko Kagoshima, Deputy Representative of UNICEF, Dr. Wokicho Jateno, Assistant FAO Representative of Ethiopia, heads of regional health bureaus and public health institutes, all protocol observed, esteemed colleagues of the Ministry of Health, EPHI, and developing partners, media colleagues and distinguished invited guests here in this meeting hall and watching live stream, welcome to this special event, and I really appreciate your presence here today. So why are we here? Today, we're here to launch the Public Health Emergency Management, or PHEM, digitalization and strategic frameworks. And also, this is where we share with you our progress of the journey towards realizing the PHEM-Center of Excellence. So thank you once again for joining us today on this special occasion. My name is Meti Shwaye Yilma, and it's an honor and a privilege to be the MC today. Oops, too many papers. Okay. There is a saying in Amharic, Nagar kasru wuha katru. Well, let me just contextualize it. It's better to start from where it begins. So let me give you a bit of a background of why we're here. In May 2025, the Ethiopian Public Health Institute, EPHI, officially launched the Public Health Emergency Management Center of Excellence initiative, an ambitious national platform designed to position Ethiopia as a leader in public health emergency management across Africa and globally. The PHEM-COE is built on a consolidative and collaborative framework aligned with the national health strategies, regional mandates, and international frameworks. It aims to institutionalize resilience, emergency preparedness, and response systems by strengthening governance platforms, workforce capacity, digital and physical infrastructure, financing mechanisms, and supply chain systems, while reinforcing strong multi-sectoral coordination. This milestone event marks the formal launch of the strategic frameworks and digital systems guiding the implementation of PHEM-COE vision. And the purpose of this event aims to formally launch key strategic frameworks guiding PHEM-COE implementation, to introduce and scaling digital systems strengthening public health emergency management, to inaugurate the renovated National Public Health Emergency Operations Center, and also to officially hand over the ICT equipment to regional health bureaus to enhance connectivity and coordinated response. And finally, to reaffirm Ethiopia's commitment to building a resilient, modernized, and integrated PHEM ecosystem. So the major milestones that we mark today are inauguration of the renovated and technologically enhanced National PHEOC, and to officially hand over the ICT equipment to regional health bureaus to strengthen nationwide connectivity and rapid responses. So let me just give you the highlight of what's happening today. So we'll have opening speeches, keynote addresses, and remarks. That will be followed by presentation on the progress on the journey towards realizing PHEM-Center of Excellence. And we'll also show you a documentary film on the progress of the journey. And finally, we'll have an ICT equipment handover and closing remark. So in between, we'll have a coffee break, and then at the end, we'll have lunch break. And during those breaks, please, we'll invite you to visit the booth downstairs. Yes, you've watched them on the screen earlier when our guest of honors were walking through them, but we highly encourage you to go visit them to see what has been done so far. So once again, thank you very much for joining us, and I will now continue. I'll invite our speakers to officially setting the tone and to welcome you. I will invite to give us the objective of the event, Dr. Melkamu Abbate, Deputy Director General at EPHI. Dr. Melkamu, please take the floor. And please let's welcome him warmly.
Good morning. እንዴት አደራችሁ? Your Excellency Dr. Maqdas Daba, Minister of Health, Dr. Masai Hailu, Director General, Ethiopian Public Health Institute, Dr. Saro Abdullah, Deputy Director General for Ethiopian Public Health Institute, His Excellency Professor Kansolo, WHO Country Representative, Dr. Wasam from Africa CDC, Dr. Wakicho from FAO, Dr. Mariko Kagoshima, Deputy Representative of UNICEF, Shushna, Deputy Director for Ethiopian Office, esteemed colleagues from Ministry of Health and APHI, Regional Health Bureau Heads, Public Health Institute Directors, members of the media and distinguished guests. On the behalf of Ethiopian Public Health Institute, it is my pleasure to welcome you all to today's milestone event. As you know, in May 2025, we launched our flagship initiative, PHEM-Center of Excellence initiative. The PHEM-Center of Excellence is based on a consolidative and collaborative framework that has been mentioned earlier. This is aligned with the national health strategies, regional mandates, and international frameworks. In line with this, we are investing in solidifying our foundational capabilities in governance platforms, workforce capacity, physical and infrastructure, financing, as well as supply chain and logistical issues, while fostering strong multi-sectoral coordination, permitting comprehensive public health emergency response. Through implementing the PHEM-Center of Excellence, we aspire to scale up PHEM in Ethiopia to new heights, transforming our vision into a model of operational excellence, knowledge management, and regional collaboration on which we firmly stand and confidently share with the rest of Africa and the world. Today we are gathered to formally launch the strategic frameworks which continue to guide our implementation. We also introducing the digital systems we are employing to enhance public health emergency management in Ethiopia. The platforms that we are going to launch are to scale up the DHIS2 and integrated health data management, the ePHEM, and other digital platforms. In line with this, today we are handing over critical ICT equipment to our regional health bureaus and regional public health institutes to build regional capacity, to enhance connectivity at all levels, ensuring speed, accuracy, and coordinated action to save lives and defend our community. We invite you to continue with us along our Center of Excellence journey as we evolve from fragmented data to unified intelligence and from isolated action to seamless national coordination centered on an integrated and modernized public health emergency management ecosystem. I thank you so much.
Thank you very much, Dr. Melkamu Abate, Deputy Director General at EPHI. For the next keynote address, please help me in welcoming His Excellency Dr. Warkicho Jateno, Assistant FAO Representative of Ethiopia. Please, let's welcome him warmly.
Thank you very much. Thank you very much, Master of Ceremony. Your Excellency, Dr. Magdas Daba, Ministry of Health of the Federal Democratic Republic of Ethiopia, Dr. Masai Hailu, Director General of Ethiopian Public Health Institution, distinguished representatives from government and of Ethiopia, colleagues from sister UN agencies, development partners, ladies and gentlemen. It is a great honor for me to join you today as this important national milestone, the official launch of Ethiopia's Public Health Emergency Management System Digitalization Program, PHEM, and the handover of desktop computers that will support the deployment across the country. Today's event is not simply about digital tools or equipments. It makes decisive step in translating Ethiopian National Action Plan for Health into practice, particularly at frontline where early detective, timely reporting and rapid response begin. It reflects Ethiopia's clear commitment to build a modern, integrated, and resilient health security system capable of protecting lives, livelihoods, and national development gains. As we emphasized during the official launch of National Action Plan for Health Security and National Health Strategy Plan, health security is not only a health sector issue. It is a national development priority with direct implication for food security, livelihoods, stability, trade, and social well-being. In this context, digitalization is not longer option. It is an essential enabler of preparedness and response. Strong emergency management systems depend on timely, accurate data from community level to national decision-making platforms. The Ethiopian Public Health Emergency System Management PHEM program provides Ethiopia with this foundation. FAO is proud to support this initiative under the Ethio Pandemic Multi-Sectoral Prevention, Preparedness and Response Project. As part of this support, FAO is officially handing over 3,400 desktop computers today to strengthen digital capacity at national and subnational levels. These computers are enablers of Ethiopia's public health emergency management system development, ensuring the frontline professionals have the tool required to report, analyze, and act on public health threats in the real time. Beyond today's handover, FAO is finalizing USD 2.1 million agreement to support the field deployment of the PHEM program, ensuring that the system is operationalized at frontline health service delivery point. This event also demonstrates One Health in action. FAO is supporting the introduction of DHIS2 digital reporting platform for animal disease surveillance under the Ministry of Agriculture, enabling operable between human and animal health surveillance system. This is how One Health moved from policy to practice. In closing, let me commend the government of Ethiopia, particularly the Ethiopian Public Health Institute, for its leadership in advancing public health emergency management and digital transformation. FAO stands ready to continue working with you to build resilient, future-ready health security system for Ethiopia. Thank you.
Thank you very much, Dr. Warkicho Jateno, Assistant FAO Representative in Ethiopia. And thank you for the support that your organization has been giving. And it's a great assistance. Thank you very much. For the next keynote address, please allow me to welcome Mariko Kagoshima, Deputy Representative of UNICEF Ethiopia, to deliver her remarks. Let's welcome her warmly.
Your Excellencies, Honorable Minister Dr. Megdes Dava, Dr. Mesai Hairu, Director General of EPHI, Dr. Melkam Abte, Deputy Director General of EPHI, Dr. Wassan from Africa CDC, my sister agencies, colleagues, FAO, WHO, and my sister from Gates Foundation. Good morning. UNICEF is very much honored to join you today for the launch of the Public Health Emergency Management Digitalization Initiative and strategic framework, an important step towards furthering strengthening resilience and protecting the health of communities across the country. I want to acknowledge the government of Ethiopia's leadership, tremendous leadership, during recent public health emergencies, including Marburg virus disease response. Effective coordination, community engagement, and strong public institutions were decisive in containing the outbreak. We learned key lessons. Preparedness. Prepared communities reduce the impact of outbreak. Coordination. Clear coordination saves time and resources. Trust. Trust between communities and health workers is essential. Primary health care. Resilient primary health care system allow community to continuously receiving essential health services. And data, functional integrated data system that we saw today is key to make response effective. Across Ethiopia, the health extension program remains one of the strongest community health systems in the region. By equipping health extension workers with better skills, tools, and digital connectivity, Ethiopia is building a system where communities can detect risks early, maintain services in crisis, and recover quickly. Empowering communities as early warning partners is essential to national health security. Digitalization strengthens the system by ensuring timely, reliable data for decision-making. When health workers and decision-makers have the information and tool they needed, emergency response improves and essential services continue even during the disruption. Digital transformation becomes a force multiplier for preparedness and primary health care. And then I would really like to congratulate for the minister and the EPHI for the impressive PHEM-COE that we've seen today. Thank you. Highlights Ethiopia's strong tradition of partnership, national leadership supported by region and global expertise. UNICEF is proud to work with EPHI through the Pandemic Fund on the Community Public Health Emergency Management Package and with the Ministry of Health to strengthen community-based systems and resilience in both stable and conflict-affected areas. Resilience cannot be built by one institution alone. UNICEF remains committed to continue strengthening the community-based primary health care to maintain services during the emergencies, supporting integrated systems that link preparedness with health, wash, nutrition, and social services, promoting learning and innovation so Ethiopia's experience informs global practice. As Ethiopia celebrates the launch of a Public Health Emergency Management Center of Excellence and expands digital systems, today's launch marks a start of a new phase focused on sustainability, scale, community leadership. The goal is not only to respond to emergencies, but to prevent crises from becoming disasters. A resilient health system is built where people live, at health posts, in kebeles, and in communities. When communities are prepared, nations are secure. Through this initiative, Ethiopia demonstrates how strong primary health care protects lives, strengthens resilience, and safeguards the future. Thank you so much.
Thank you very much, Ms. Mariko Kagoshima, Deputy Representative of UNICEF Ethiopia, and I actually liked how you summarized everything together, why we are here. It's because of preparedness, coordination, and trust that's supported by data. That's well said. Thank you very much. For the next keynote address, please allow me to invite Ms. Susna D., Deputy Director of Ethiopian Country Office of Gates Foundation. Please, let's invite her. Ms. Susna D.
Good morning, colleagues. Your Excellency, Dr. Mekdes, Dr. Masai, and Deputy Directors of EPHI, Dr. Malkamu, distinguished leaders from UNICEF, Africa, CDC, WHO, and I'm sure there are more in this room, valued partners, regional health bureau leads, and friends. Good morning, everyone. It's an impressive turnout today. It really is a privilege to stand here with you on behalf of the Gates Foundation at the launch of a very significant milestone in Ethiopia's public health surveillance, emergency preparedness, and response. Your efforts here today advance towards a state-of-the-art digital, integrated, but community-oriented system. It's visionary, and it will help meet the complex challenges of today and even tomorrow. At the Gates Foundation, our engagement in Ethiopia is guided by three core principles: country leadership and ownership. And that's actually all three: country leadership and ownership. It ensuring that public health systems, data, and decisions are firmly led by Ethiopian institutions. We also focus on catalyzing impact. How do we support investments that translate into faster detection, more effective response, and ultimately lives saved? And then also durability of systems, building systems and institutions that continue to perform and, more importantly, adapt. So as we keep on hearing today, it's about resilience. It's not just about sustaining. It's about adaptation as well as evolution and resilience. so that that's continues long after external support has stepped back. These principles align closely with the government of Ethiopia's vision for a resilient, data-driven public health system. The government sets the strategic direction and priorities, and our role is simply to help support helpful and maybe state-of-the-art innovations from various parts of the world, as well as elevating those innovations that come from Ethiopia to the rest of the world. And then also is trying to support the foundational systems such as surveillance, data management, and analytics, preparedness, and coordinated response so that national investments deliver maximum and sustained impact. In fact, colleagues, we have actually a number of colleagues from the Gates Foundation coming next week, including from all of our surveillance teams, and I'm hoping that they'll be able to see the exhibits here. And they're really interested in seeing Ethiopia as the exemplar for the region, for the world as well. Our support here focuses on three interconnected areas to date. First, organizational capacity building, because strong systems ultimately depend on strong institutions and systems. It's been a pleasure to provide support to EPHI, to the ministry as well in this regard. Second, we are supporting more intentionally surveillance to help transition from fragmented disease-specific approaches towards more collaborative, integrated, timely, and actionable surveillance systems. And we have also provided a lot of support to the National Data Management Center, strengthening analytics, modeling, and the routine use of data so that evidence directly informs policy decisions and resource allocation. We're also interested and have been supporting a modeling consortium to try to elevate the role of universities as well as the ministry to guide EPHI and other academic institutions to model and use analytics for timely decision making. Partnership is central to this journey. Platforms such as the EPHI such as the EPHI Partner Forum plays a critical role in bringing government, donors, and implementing partners together around a shared architecture, reducing duplication, strengthening coherence, and accelerating collective learning. Today's launch rightly places EPHI PHEM at the heart of integrated surveillance, preparedness, and response. Digitization, systems integration, and interoperability are not abstract concepts. They are practical enablers that allow surveillance signals to flow seamlessly into analysis, timely decision-making, and coordinated action, especially when time matters the most. This is particularly critical in the context of the evolving ODA, or donor landscape, that we are witnessing. EPHI's leadership in advancing this vision is critical not only for Ethiopia, but also to serve as a regional model and center of excellence for integrated surveillance, emergency preparedness, and response. Let me close with this thought. One thing to note is that data has value only when it is used to make decisions. And here today, we are seeing that decisions can be made at all levels of the health system. What we celebrate today is not simply new platforms or frameworks or screens, but a shared commitment to using data to protect communities, to strengthen preparedness, save lives, and livelihoods. Thank you for your leadership, your partnership, and your continued commitment to a safer and more resilient Ethiopia, and indeed a resilient Africa. Thank you.
Thank you very much, Ms. Susnahdi, Deputy Director, Ethiopia Country Office of Gates Foundation. Country leadership and ownership. That's a great motto, and that's actually what led us to the Center of Excellence. Country leadership and ownership. It summarizes it all. Thank you so much. Okay. So now I will invite His Excellency Professor Francis Kasolo, WHO representative of Ethiopia, our strategic partner. Please let's welcome His Excellency Professor Francis for his keynote address.
Thank you very much, Director of Ceremonies, Your Excellency, Dr. Magdas Daba, the Minister of Health of the Federal Democratic Republic of Ethiopia, Your Excellency, Dr. Masai Hailu, the Director General of the Ethiopia Public Health Institute, and soon to be the WHO Collaborating Center, Your Excellency, Dr. Malcolm Abet, the Deputy Director General of Ethiopia Public Health Institute, and the other Deputy Director Generals of the PHI present, Deputy representatives from UNICEF and FAO, colleagues from Africa CDC and the Gates Foundation, distinguished guests, colleagues, partners, media, ladies and gentlemen. Allow me to begin by sincerely congratulating the Ministry of Health and the Ethiopia Public Health Institute for their strong leadership during the recent Marburg response and for the launch of the Public Health Emergency Management System, Digitalization, and Strategic Framework. The swift detection of Marburg virus disease and rapid activation of the incident management system and coordinated national action demonstrated the growing strength and maturity of Ethiopia's public health emergency management system. This performance is particularly significant in a global context where, according to the World Health Organization, the number of reported health emergencies has increased substantially over the past 2 decades, driven by emerging infectious diseases, climate-related shocks, humanitarian crisis, and indeed population mobility. Africa alone continues to face over 150 significant public health events annually. Therefore, preparedness is no longer an option. It is essential. Distinguished ladies and gentlemen, today's launch of the Public Health Emergency Management Digitalization and Strategic Frameworks marks a historic milestone in Ethiopia's journey towards health security and resilience. Not long ago, emergency management processes were largely paper-based, as we saw downstairs, manual, fragmented, and reactive. Today, we are witnessing a measurable transformation. The modernization and expansion of the public health emergency operations centers, combined with interoperable digital platforms, have enhanced early warning surveillance across Ethiopia, improved event-based surveillance systems, strengthened laboratory linkages, and enabled real-time data visualization for decision makers. This digital transformation will enable automated signal detection, centralized alert management, structured workforce deployment, and dashboard support decision making. These improvements will reduce the time from detection to verification and from verification to response, the critical window that determines whether outbreaks are contained locally or escalate nationally and indeed internationally. Your Excellency, globally, evidence shows that countries with functional emergency operations centers and digital surveillance system detect and respond to outbreaks up to 30 to 50% faster than those without such systems. Therefore, speed saves lives, speed protects economies, and speed builds public trust. Ethiopia's investment in this Center of Excellence, therefore, strengthens infrastructure, institutionalizes standard operating procedures, and builds a skilled, multidisciplinary workforce aligned with the International Health Regulation 2005 core capacities. It also reinforces Ethiopia's capacity to respond not only to epidemics, but to floods, droughts, and other complex emergencies that increasingly intersect with health. The World Health Organization is proud to have supported this journey through technical collaboration in digital architecture design, governance frameworks, workforce capacity building, and systems modernization. Together, we are not merely deploying tools. We are institutionalizing a resilient, data-driven emergency management ecosystem aligned with global standards. Furthermore, the WHO expresses sincere appreciation to key partners and donors whose strategic investment have accelerated preparedness, surveillance, integration, laboratory strengthening, and coordinated response. This progress positions Ethiopia as a potential regional hub for training, technical assistance, and knowledge exchange across Africa and beyond. It advances the vision of designating the Public Health Emergency Center of Excellence as a WHO collaborating center and contributes to continental health security. Indeed, and I repeat, indeed, the Public Health Emergency Management Center of Excellence will soon become a WHO collaborating center for emergencies. The digital backbone now in place will provide a scalable platform for future innovations, including artificial intelligence-enabled analytics, predictive modeling for epidemic intelligence, and climate-sensitive surveillance systems. With strong governance and interoperability frameworks established, Ethiopia is now well positioned to continue advancing digital maturity across the broader health sector. This is the measurable progress we talk about. This is institutional transformation, and this is a national leadership in action. As I conclude, I would like to state that the World Health Organization remains fully committed to supporting Ethiopia in strengthening health security, protecting communities, and ensuring that no public health threat goes undetected or unaddressed. Congratulations again for the launch of the Public Health Emergency System Digitalization and Strategic Frameworks, and also the relaunch of the ultra-modern Public Health Emergency Operations Center. Amasekanalo.
እኛም በጣም እናመሰግናለን Your Excellency Professor Francis Kasolo, WHO representative Ethiopia. And thank you once again for reaffirming your commitment and the support of WHO, not only to EPHI, but to Ministry of Health and in general to the health sector of Ethiopia. And indeed, the Center of Excellence will become a strong partner with WHO. It already is, anyway. Okay, thank you very much. Now I will call upon a representative from another strategic partner from CDC, African CDC. Allow me to invite His Excellency Dr. Wissam Mankula. He is the Regional Director for Northern RCC at Africa CDC. Please help me in welcoming him to the podium.
Good morning, everybody. Salamna. Your Excellency, Minister Dr. Magdis, Minister of Health of Ethiopia, Your Excellency Dr. Masai Hailo, Director General of Ethiopian Public Health Institute, Your Honorable Dr. Melkamo, Deputy Director General of Ethiopian Public Health Institute, our colleagues, brothers and sisters from different partner agencies, WHO, UNICEF, FAO, Bill and Melinda Gates Foundation, and other partners, ladies and gentlemen. It's really a privilege to be here today on behalf of His Excellency Dr. Jan Kaseya. Unfortunately, he couldn't be today with us because of other urgent engagement. It's really a privilege for Africa CDC to stand with Ethiopia today while launching this important moment about Public Health Emergency Management Center of Excellence. Today, it's not a simple handover equipment event, but it's a declaration for preparedness, ownership, and African leadership that we are seeing led by Ethiopian Public Health Institute and the Ministry of Health of Ethiopia. I have today 4 key messages. First one, moving from infrastructure to strong public health emergency management system. AUC is not just having high-tech equipment. Emergency Operations Center, it's about system, about well-trained human resources, about having access to data and using those data. The model that we're seeing today in Ethiopia, and we're handing over to Ethiopian Public Health Institute, this is one of the 23 Public Health Emergency Operations Center that Africa CDC, in collaboration with African Development Bank, doing to support our member state to enhance the infrastructure related to Public Health Emergency Operations Center. While we are speaking today, 20 countries already, they have a state-of-the-art facility for Public Health Emergency Operations Center, and in the coming few weeks, additional 3 countries will be completing the installation of their Emergency Operations Center. We are happy today that the first Emergency Operations Center under this collaboration between Africa CDC and the African Development Bank, we are handing it over to Ethiopian Public Health Institute. But as I mentioned, it's not about the equipment, it's about building the system. And what we have seen today, different frameworks, different tools, either for risk communication and community engagement, for surveillance, for logistics and supply chain, this is what complete the full picture to have a strong public health emergency operations center. My second message, building people, not just system. And this is very critical. If you bring the high-tech equipment without well-trained human resources, this Public Health Emergency Operations Center will not move forward. This is why in Africa CDC we launched Africa CDC Public Health Emergency Management Fellowship, 6 months fellowship to give comprehensive training for experts from different African countries. We are happy in the first 2 cohorts, we graduated 27 experts from the continent and 2 of them from Ethiopia, and one of them even he got promoted recently after returning back from Africa CDC Public Health Emergency Management Fellowship. And this fellowship and different activities we are doing in the Emergency Operations Center, this is not done alone by Africa CDC, but it's done through strong partnership with our colleagues from WHO, with our colleagues from USCDC, Bill and Melinda Gates Foundation, Resolve to Save Lives, UK Health Security Agency, European CDC, and different partners. And while we're here today, I have to recognize 2 heroes that we started this journey together. Maybe most of you, they don't know them, but the real veterans in the Emergency Operations Center, they know them. So please recognize my colleagues Sanait and Ali from WHO Afro and WHO Amru. Please, let's give them a big round of applause. Those are the people, those are the real people that we started the journey of the Emergency Operations Center together back to 2018. Let our strength to bring all the key partners together, share one goal, one objective, strengthening public health emergency management in Africa. And we are happy to see the progress happening here in Ethiopian Public Health Institute. My third message, Ethiopia rising. And rising through leadership, through actions. And this is what we are seeing in the leadership of EPHI and the leadership of Her Excellency Minister of Health. And this is what we want to see as Africa CDC. We don't believe that strong Africa CDC means that for each emergency happening in the continent, our team should be jumping to support our member state to respond to various emergencies and all other partners who come to support those countries. This will be a failure for us. Our success, it's mainly when we build a strong system at national level. And this strong system depends on the leadership of the country and requesting minimal support from international organizations. And this is a key factor for success for us in Africa CDC. I always tell our colleagues in emergency preparedness and response in Africa CDC that our job in Africa CDC, our job to become jobless. How to become jobless? When we have a strong national public health agencies, strong Ministry of Health that depend on the local resources and requesting only for minimal international assistance. I'm witnessing the progress happening in Ethiopian Public Health Institute over the last 10 years. This is really impressive experience, and this is a role model for other public health institutes in the continent. My fourth and last message, from national asset to regional engine. Yes, it's good to have Ethiopian Public Health Institute as one of the national public health institutes in the continent. But while we are building this national asset, we are not looking for building this national asset only for Ethiopian, but this is to support other African countries. And this is what we are looking for as Africa CDC, to show solidarity between African member states. This is why when we have PHEM Fellowship, we are bringing our cohorts, our fellows, to come and see and learn from the model of Ethiopian Public Health Institute. We're looking for more collaboration with EPHI to bring other countries to learn from the progress happening here in Ethiopia. Excellencies, colleagues, today, while we are inaugurating the Emergency Operations Center, supported by Africa CDC and also other partners supporting different initiatives, this inauguration is a declaration for confidence. Confidence that Ethiopia is ready with infrastructure, system, and data transformation, and well-trained human resource. It's confidence in the model that we are seeing as Africa CDC, that will be working to replicate the same model in other African countries. It's confidence that the future of our health security will be written by us, not for us. I thank you.
Thank you very much, Your Excellency, Dr. Wissam Mankula from Africa CDC. Yes, the critical elements of any development, any progress are infrastructure, system, and most importantly, people. So we really appreciate your strategic partnership. Okay, so now to give us the welcoming remark, I will invite Dr. Mesai Hailu, Director General of EPHI. Let's welcome him warmly. Let's give us the keynote, the welcoming remark, and invite Her Excellency, our guest of honor.
እንደምን አረፈዳችሁ ክብርት ሚኒስትር በጣም እጅግ አድርገን እናመሰግናለን ለጠንካራ አመራሮና ጊዜውን ሰጥተው ዛሬ ስለተገኙልን Your Excellency Dr. Mekdes Daba, Minister of the Federal Democratic Republic of Ethiopia, Minister of Health, Professor Francis Kasolo, WHO Country Representative, Dr. Workicho Jeteno, Assistant Ethiopian FAO Representative, Susnadi, Deputy Director for Gates Foundation Ethiopia Office, my colleague Dr. Melkamu, Deputy Director General of Ethiopian Public Health Institute, distinguished Regional Health Bureau Heads, Regional Public Health Institute Director Generals, Dr. Mariko Kagoshima, Deputy Representative of UNICEF Ethiopia, Dr. Wessam Mankwala, the Africa CDC representative, distinguished colleagues, members of media, ladies and gentlemen, it's a profound honor to welcome you all to this ceremony as we officially inaugurate our digitalization initiatives and strategic framework for public health emergency management. We gather here today at the Ethiopian Public Health Institute to mark significant milestone in Ethiopia's journey towards becoming a center of excellence in managing public health threats. In recent years, we have encountered and effectively managed different public health emergencies. The experiences learned from global public health emergencies, such as COVID-19 pandemic, have proved that harnessing digital tools is no longer an option, but rather a fundamental requirement for effective public health response. Today, we are here to officially launch crucial digital systems, including the epidemic intelligence from open sources, the electronic public health emergency management, and DHIS2. Along with this platform, we are launching core strategic documents on risk communication and community engagement, Public Health Emergency Operations Center, and workforce strategies. These efforts
demonstrates Ethiopia's unwavering commitment to developing a proactive, technologically driven public health emergency management system. The EIOS system will act as our national digital sentinel, continuously scanning global and local data to detect health threats at their earliest onset, thereby granting us the valuable gift of time. The DHIS2 provides a crucial foundation for collecting, validating, and analyzing, as well as presenting statistical data for public health emergency management and decision-making. Finally, the public health emergency management serves as our electronic command center, facilitating coordination, tracking resources, and providing real-time administration during emergencies. When combined with our strategic framework, these systems form a unified shield that directs our entire operational workflow. This collaborative approach represents a fundamental shift in public health management, from fragmented responses to integrated and real-time responsiveness, from delayed data reporting to digital surveillance and early warning systems, and towards the utilization of data for actionable decision-making. Let's finally and officially launch this collective call to action to use these tools to their full capacity to maintain our standards as a center of excellence and to collaborate to safeguard the health of our communities. Finally, I thank WHO, Africa CDC, FAO, Gates Foundation, US CDC, UK Health Security Agency, Results to Save Lives, and other, our reliable partners for your impactful support and collaboration. I wish you all a pleasant stay and deliberations. I thank you.
Thank you very much, Dr. Masai Hailu, Director General of EPHI, and thank you for the leadership, for your leadership to create the Center of Excellence. It's really impressive. Thank you. All right, ladies and gentlemen, please now allow me to welcome our guest of honor to give us her opening remarks, Her Excellency Dr. Maqdas Daba. Please let's welcome her all to the podium. Your Excellency Maqdas Daba, Minister of the Ministry of Health of the Federal Democratic Republic of Ethiopia.
በእግዜር ብያለሁ። እንደምን አደራችሁ? እንደምን አደራችሁ እንዴት ዋላችሁም ስለሆነ good morning, bonjour for a team who's with us from a global community. እንኳን ደህና መጣችሁ። እንኳን ለዚህ ቀን በሰላም አደረሰን። በቅድሚያ Your Excellency Dr. Masai Hailu, Director General of our Ethiopian Public Health Institute, Dr. Melkamu Abete, Deputy Director General of EPHI, all other management members of EPHI, Professor Francis Kasolo, WHO representative of Ethiopia, representatives from UN agencies, Mariko from UNICEF, and also Dr. Wakicho from FAO, representatives from Africa CDC, Dr. Wassam. It's a pleasure to have you here. All representatives, Shushna from Gates Foundation, sister organizations of all non-governmental and governmental institutions, representatives of our institutions in different entities, management members from our management from Ministry of Health, regional health bureau heads who are with us in here, and also all diplomatic community who's in this here, or guests from, I've heard from EMRO. It's a pleasure to have you all, representatives from all other UN agencies in this room, partners, colleagues. It's a pleasure to welcome you here today. It's a great honor to welcome you again to the official opening, and here our representatives from countries, from CDC, all in here. Today's significant milestone in Ethiopia is a journey of strengthening national public health. I've heard it before, I've also said it before, but I will say it again. We don't have a time to waste when it comes to public health. We all have to integrate, we have to act, and we have to use data. And today's session is more about converting our speech to action. We've been talking about having an integrated system, strengthening our institutions, and ensuring that not only our continent, not only our country, not only our people are protected, but the globe is protected, and our country and our government is more committed. Today marks a significant milestone because as we gather here today to formally recognize our progress towards realizing a Public Health Management Center of Excellence, our central PHEM of excellence, a vision grounded in collaboration, innovation, but also a strategic reform. If you look at the digital transformation agenda we have in the country, we had the previous national digital agenda set until 2025, and the current digital plan we have until 2030, and this is going to continue. Our Ministry of Health, as part of an enabler, but also as an implementer when it comes to digital health tools, digital health implementation, we're aligning our vision and we're aligning our digital strategy with Ethiopia's Digital 2030 vision. At the heart of this transformation lies digitalization, because data, without having a robust digital mechanism, is not going to be around. We used to have data, we've been keeping them, and we are not that much using them. We can only be informed if you are having data that you can translate, that you can use it for prediction, but also use it for real-time action. This work is fully aligned with the national vision of the 2030 agenda, because our national vision in 2030 is to have Ethiopia, which is more equipped, professionals who have the capacity and the skill, but also institutions that have the capacity to inform the nation. That is not only for the community and here, but also to inform the global public. With this framework, the ministry, our Ministry of Health, is implementing a comprehensive total digital health strategy. And to date, 47 digital health tools are operational across the country, digital health tools. We're making sure that they're integrated, they're also reading each other so that we have one system platform, and modernizing our service delivery, surveillance, coordination throughout the system. At the foundation of our digital architecture is the progress of measurable transformation, the master facility registration we have. Unless we know how many facilities we have, that is usually difficult. But now we have already revitalized our master facility registration, where we have 52,000 health facilities registered in our MFR. You can also check. We have mfr.org.et. You can check where the facilities are around, which facilities have their license renewed, when was the last license done. And this is also aligned with also the health professionals we have in each facility. So the earlier we have a real-time data when it comes to where the facilities are, what services they are giving, and where our professionals are, then we can also start to predict and also get prepared on whom to train, where to train, and where to concentrate around. The electronic community health information system expanded to more than 9,000 health posts now. We need to expand more because we know the numbers, but we need to expand. With that, we have also already now more than 30 million population with our ECHIs, where we get data directly from the community, equipping frontline health workers, not only in logging data, but also enabling them to learn while they're also treating their community. Equipping frontline extension workers with real-time reporting mechanism so that we can predict earlier, we can also detect earlier, and also respond in our capacity by coordinating platforms. This achievement represents structural reforms towards an integration data-driven health system, but also supporting transparency, efficiency, and most importantly, informed leadership. Because unless we have an information, how can we lead? Everything we have to be driven with data and information. These achievements represent also a strategic change that we are doing, consciously investing on institutions' capacity, but also looking at what works and what didn't, because now in the next few months, you will see that we will do several transformation in our implementation platform on what worked over the years, what are the things that we need to change in the next strategic plan. Today's operationalization of epidemic intelligence from open source system is also the electronic public health emergency management system, the public health emergency management district health information system, version 2, DHIS 2. But I am also going to challenge my colleagues again, and also the digital community again. This is not going to be only for us, but also for other sectors. Ministry of Health does not deliver everything by itself. We work with other ministries, other agencies, like our Artificial Intelligence Institution, our Ministry of Technology and Innovation, our Science Innovation Technologies, and also universities at the center of it, to look at what type of data should we do. How can we have our own platform in the future? These platforms that we have so far are helping us, but we need to also develop more so that we can have our own tools to really read or also work in integrating language that others can easily interpret. We have the 5 languages, as you have seen earlier, in some of our logging platforms, but the earlier we can teach the machine. When I'm also challenging our WHO colleagues, even in the recent discussion we had around, in the future, when we set guidelines, when we set standards and protocols, how can we mitigate and how can we get prepared in the changing era that people can just Google, can do some analysis by themselves? What is the preparation we do in our capacity to mitigate earlier, to teach the machine, and to have community that can also help us use AI for supporting our community in a real time. These platforms have been a backbone of a modern disease intelligence and emergency coordination architecture anchored in the Public Health Emergency Operations Center. We've seen it recently, and the centers and the platforms we have now have been tested even during our Marburg outbreak. I want to take this opportunity to thank also our Deputy Director General, the team, the Director General of the institution, the entire team at large, who've been working very hard to ensure that we deliver to our community and to our people, to our nation, even at a time which was very difficult to all of us. But parallelly, they were really working very hard. Thank you so much on behalf of my heart, myself, the ministry, and the community we serve. In the past, surveillance relied heavily on paper, as we remember, but we are planning to deploy more now with the support we have from our partners who have contributed through the different systems we have, from the pandemic fund, through other entities we have with the African Development Bank, other entities that are supporting us in technical capacity, but also delivering and more analysis. This is going to be something that we will deploy from paper-based to now shifting to the digital delivery platform. Today, we have translated into a real-time information management and evidence-informed decision-making. The successful containment of the corona outbreak back in 2019 and then to 2020, where all of us were all shocked. And imagine if it was that much easier to have real-time data from each border, from each corner of the world. But now we have a lot to do. Really happy that we are collaborating with countries to ensure that we have also government-to-government platforms that we are initiating to ensure that we have data, we share data with each other, and we protect each other. Today, we have transitioned to a real-time data. As you have seen, without further geographic spread, we can do a lot, and we can also see an experience we have from Mpox recently. Some of us have already forgotten that Mpox was there just a year back, and still some countries are still struggling around this. With Ethiopia being a hub, with several flights coming, and with the fact that we have a lot of cross-border related issues, there is a lot to do. And the more we shift from paper-based to digital, we can act earlier, we can detect earlier, and also protect our community. We also inaugurated the renovated National Public Health Emergency Operations Center, a cornerstone of our national preparedness and response capacity. The AOC Center of Excellence being not only for us, but also for the region. Thank you, our partners. However, the system alone is not enough. We need more people who get trained, who are digitally savvy. We need to incorporate it into the community mechanism that we can detect earlier. So our health extension workers, our community health workers are enabled, both in the digital learning platform, but also to ensure that the connections are also staying very active. We will work with other entities, our other infrastructures that we need to build at a national level. We have a 2030 agenda to ensure that a minimum of 80% of facilities could have more access to primary health care by the end of 2030. We also align that more than 40 million community will benefit again from an expanded primary health care facilities. Infrastructure must be matched to accountability, simulation exercises that we need to do more, because the more digital we do, the more we have to protect also our community and our data. And continuous learning, because it's a learning curve, we're learning, we're leapfrogging with digital tools, but this is also a time for us to learn more what works in our community, what are the things that we need to change to enable our community with different language barriers we have. I therefore call upon regional health bureaus, development partners, and also those present in here to fully utilize this system to address operationalization gaps that we would be identifying, to ensure that seamless information flow from community level to national leadership and back is ensured. Today's demonstration that we have seen shows that Ethiopia can when we do together with the community, with our partners, with like-minded community that wants to deliver to our people. We stand ready to work with you on innovation. There is a lot that we need to innovate still, because there are gaps that we cannot fill without having a strong innovation at the center. But I also want to challenge again our partners, our regional health bureau heads, our Director General, and also the community at EPHI to challenge again how fast and how far are we using our data. And this is going to be a challenge that we want to deliver to the community with the launch of today's digital tools that you have seen. We'll be using them. We will also measure our accountability, our speed, our new modelings that we will give out to particularly universities who want to also collaborate, who wants to work with us. Data, if they're not used, are useless. Data should inform us, should guide us, but also we need to protect them so that this is also a national treasury. Let us build on the momentum and the continuous advances. I'm really proud that my team has delivered already on the promises that we have made when we met back in 2024 now. And 2025, we also had a recent again challenge, but now there is a lot that we have advanced, but the gaps are still huge. There is a lot to do, there is a lot to run, and there is a lot to deliver, because 2030 is just 4 years away. It's not even 5 anymore. It's 4 years away, and we have already promised to our community. Let us build on the momentum we have so far to advance a resilient and a digitally driven health system capacity, protecting our people, safeguarding the future of our nation. I thank you all.
Thank you very much, Your Excellency Dr. Maqdas Daba, Minister of the Ministry of Health of the Federal Democratic Republic of Ethiopia. The last few years, actually, we've seen events after events of public health emergencies, health issues. And the Ministry of Health actually has been very efficient. You're right, I completely forgot about Mpox and Marburg. And I guess you guys are doing it excellently and quietly without having us to worry about anything. So yes, let's put our hands together for Ministry of Health and for EPHI, because also so much data comes in this institute analyzed, and decisions have been made quickly. That's why we Ethiopians and anyone who lives in Ethiopia can live with our peace of mind. So thank you for doing that. Okay, so we'll do a bit of a reshuffle of our schedule, because we know, Your Excellency, you came from a middle of a meeting to grace us with your presence. So we'll let you go in few minutes. So what we will do is we'll come back after coffee break for the presentation and for the documentary. But right now, let's have the ICT equipment handover, and Your Excellencies, our guest of honors, and also to be accompanied by the Regional Health Bureau and Regional Public Health institutions leadership, and also EPHI Director General and Deputy Directors. Let's go outside, let's have the handover, and then Your Excellency, you can leave, but then the rest of us will come back after the coffee break. So let's rise up and let's have our excellencies go to the session where we'll have our handover. And the rest of our guests, let's please visit the booth, because the exhibition has so much information. We'll come back after 30 minutes for the next session. We'll have the coffee break parallelly.
Black keys, white keys, best friends understand. Talking about it, never hide anything. This room is on fire, my heart's beating louder. This room is on fire, my heart's beating louder.
Dano.
የአደጋ ምላሽ
Risk, I never thought it'd be this. I'm jumping out of your arms. I land and fall in the pit. Is this what they call the abyss? I fought and clawed for an inch. Turning a miracle mile. Call on your lips. Used to contort in the smiles. Bright as the sun, just running the clips. I haven't seen light in a while. Risk. Even though you mad at me, you don't want to give me clarity. Touch me to your character. On your birthday, you told me to donate money to charity. You want me to sincerity. And you got K like 70, you tether me, but my stress don't bury me. You don't want to take care of me, I'm so gone, in conclusion, foregone. Where a war zone is torn on, I'm ready to go home, I'm ready for your bed. I just want my hair rubbed, I want a mixtape, I just want the best of, I just want to get grub from my spot again. But do the odds work in our favor, stay down, escape time. Head on face down like a kennel greyhound. Doing God's work in the devil's playground. Risk, I never thought it'd be this. I'm jumping out of your arms. I land and fall in the pit. Is this what they call the abyss? I fought and clawed for an inch. Turning a miracle mile. I could recall when you lived. Used to contort in the smiles. Bright as the sun, just drawn in the clips. I haven't seen light in a while. Hasn't been bright in a while. Risk. Risk. Wish you pick up all my calls. I've been going through withdrawals, trying to take the edge off. I need Novocaine. I've been trying to stand tall. I hope that you stand with me. You know all the great fall. Shit is all the same. Hot as napalm. Next day come the rain. Gotta stay calm. Press play. Put my heart in all of these songs. Display all of these wrongs. Yeah, part of me is gone. And you are a gift in itself, a measure of wealth, the meaning is selfless. I place you over the shelf and hide the pedestals over the belt, straddle the waist on rods constellate. Observation of you, here come the truth, I'm most overdue. Stuck over you, I've gone under, living proof of God's wonders. Risk, I never thought it'd be this. I'm jumping out of your arms. I land and fall in the pit. Is this what they call the abyss? I fought and clawed for an inch, turning a miracle mile. I could recall when your lips used to contort into smiles, bright as the sun's drawn in the clips. I haven't seen light in a while, hasn't been bright in a while. Brother, brother, we don't speak much. Brother, brother, no, we know. It's been a while since I happy road. Our ships in open. Will our feelings ever show? I hope you learn to love. Trust me, you've been a monster. Brother, brother. Brother, brother. Brother, brother. Brother, both of us, we know. It's deep inside, we know. You feel when it's right, you feel when it's wrong. I love you so, I write you a song. I give you shame, I was a clown. You made me who I am now. Spreading kindness all around. One day I will hold you tight. Brother, brother. Saw that thing so beautiful. She just hit my heart, oh. Full force and she got me like, I be like, baby, why you so fine? Gotta make you mine. So hard to find. Baby, like, oh, how'd you do the thing? The way that you do it, and she ain't even show nothing. She be walking around so confident, so heaven sent. I think she was meant to knock them daylight. Like, girl, you so fine. Oh, 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 oh. Yeah. Girl, you rockin' like, baby, so fine. Miss Baby, girl, you knock 'em dead. She was so sublime, super fine. She was never lying, strutting in the heels or her slides. Either way, eyes on her every single day. know she does it with no fear. All that confidence, was it heaven sent? Does it come within? Does it come run out? I don't know.
Questi dammi sono fagli.
Welcome back. እንኳን ደህና መጣችሁ። ባካችሁ ጥኡም ዜማ ስትሪንግ ግሩፕን አመስግኑልኝ ስለ ጥኡም ዜማቸው። ጥኡም ዜማ ስትሪንግ ግሩፕ thank you very much በጣም እናመሰግናለን። Your Excellencies, distinguished guests, ladies and gentlemen, welcome back. I hope you enjoyed your coffee break. I know most of you have already started some conversations, probably that will lead to new partnerships. Don't worry, we still have time. After the session, we'll go out for lunch and then we'll have more time to network, to collaborate, and to continue the conversations. So what have we achieved so far? As you have witnessed in the morning, we inaugurated the renovated and technologically enhanced national FERC, and also we officially hand over ICT equipment to regional health bureaus and strengthen nationwide connectivity and rapid response capacity. We also had key strategic documents. You probably found them in your bags. If you haven't, please make sure that you don't leave without those documents. And those are PHEM-COE strategy, national surveillance strategy, FERC strategy and handbook, risk communication and community engagement strategy, travelers and border health strategy, emergency coordination framework, comprehensive PHEM implementation handbook, collaborative surveillance framework. In case you don't find them today, you will also find them in the near future. So for this next part, there is a saying in Amharic, right? Wag bayni gabal. Narratives are better absorbed visually. So let's start with a documentary film. That film will show you about the progress and the journey. So let's watch that documentary film on the progress and journey towards realizing PHEM-Center of Excellence. And after that, we'll have a presentation. So enjoy the documentary film and I'll be right back after that.
ያደጋ ምላሽና አሰጣጥ አስተዳደሩን ደግሞ የበለጠ በማቀናጀት የልቀት ማዕከል በማድረግ ትልቅ ስራ እየተሰራ ይገኛል።
የህብረተሰብ ጤና አደጋ ቁጥጥር ስርዓቱን ማዘመን ዲጂታላይዝ ማድረግ
አሁን ወደ ደረሰበት 85% እና ከዛ በላይ ማድረስ ይችላል ማለት ነው። ይሄ ትልቅ የሆነ አቺቭመንት ነው።
በዚህም እንግዲህ ለጤናው ዘርፍ ትልቅ ትርጉም አለ። ይሄ ትልቅም ምርታ ይዞ የሚመጣ ነገር ነው።
በ21ኛው ክፍለ ዘመን የህብረተሰብ ጤና አደጋዎችና የወረርሽኞች ድግግሞሽ በከፍተኛ ሁኔታ እየጨመረ መጥቷል። የኢትዮጵያ ህብረተሰብ ጤና ኢንስቲትዩት ላለፉት 100 ዓመታት በህብረተሰብ ጤና ስራዎች፣ የህብረተሰብ ጤና አደጋዎች ቁጥጥር፣ የላቦራቶሪ ጤናና ምርምር እንዲሁም የጤና መርጃ ስርዓት አስተዳደር ተግባራትን እያከናወነ የቆየ አንጋፋ ተቋም ሲሆን በከፍተኛ ሚኒስቴሮች ምክር ቤት ህግ ስልጣን የተሰጠው የጤና ሚኒስቴር ተጠሪ የሆነ ተቋም ነው።
የኢትዮጵያ ህብረተሰብ ጤና ኢንስቲትዩሽን የኢፒኤችአይ ማለት ነው የህብረተሰብ ጤና አደጋዎችን ቁጥጥር፣ የላቦራቶሪ ምርምር ስራዎቻችንን፣ የጤና መረጃ ስርዓት አስተዳደሩን ትግበራ የምናደርግበት ትልቁ አንዱ ተቋማችን ነው ማለት ነው። ይህ ለጤና ሚኒስቴር ለኛ ሴክተር መስሪያ ቤት ተጠሪ የሆነው ተቋም ደግሞ የጤና አደጋዎችን ቁጥጥር ማዕከል በተለይ ባለፉት ጊዜዎች በጣም ትልቅ ስራ የምንሰራበትን ፌም ማለት ነው የህብረተሰብ ጤና አደጋዎች ቁጥጥር ማዕከልን የህብረተሰብ ጤና አደጋዎችን ለመቆጣጠር የምናደርጋቸው ቅድመ ዝግጁነት፣ በሽታ ቅኝታችንን፣ ቅድመ ማስጠንቀቂያ ስራዎቻችንን እንዲሁም ደግሞ የምላሽና የመልሶ ማገገም ስራዎቻችንን እያከናወንበት የምንገኘው ተቋማችን ነው።
የህብረተሰብ ጤና አደጋ ቁጥጥር ስርዓቱን ማዘመን ዲጂታላይዝ ማድረግ በተለያዩ የግንኙነትና ቴክኖሎጂ መሳሪያዎች ማጠናከር በብሔራዊ ደረጃ ብቻ ሳይሆን በክልሎችም እንዲሁ ማጠናከር እጅግ አስፈላጊ መሆኑን በመረዳት የተለያዩ የግንኙነት ቴክኖሎጂዎችና መሳሪያዎች ተገዝተው አሁን ከዚህ በፊት የሚያሰራጭናቸው አሉ። አሁንም በክልሎችን አቅም ለመገንባት የምናሰራጭ ነው የሚሆነው። የዚህ የዲጂታላይዜሽን የማዘመን አካል ነው። ይህ ደግሞ እጅግ አስፈላጊነቱ አንደኛ የቅኝት መረጃዎችን በፍጥነት ለመለየትና የመረጃ ቅብብሎች ስርዓቱን ያጠናክራል፣ ጊዜ ይቆጥባል፣ ተአማኒነትን፣ ወቅታዊነትንና ጥራትን ስለሚያሻሽል አስፈላጊ መሆኑ ታምኖበት በመንግስትም ከፍተኛ ትኩረት የተሰጠው ዘርፍ ስለሆነ ዲጂታላይዜሽን የህብረተሰብ ጤና የቅኝት ስርዓቱን ዲጂታላይዝ እያደረግን ነው።
ህብረተሰብ ጤና አደጋዎችን ዲጂታይዝ የማድረጉን ስራ ስንመጣ ሰፋ ያለ መልክ ነው ያለው። ስለዚህ ይሄ የሚታየው አንዱ እያንዳንዱ ስራ ከሚሰራበት ከመሬት ጀምሮ ከማህበረሰቡ ከታች ጀምሮ እስከ ላይ እስከ ናሽናል ድረስ ያለውን ይሄንን ማያያዝ ያስፈልጋል፣ ማሰናሰር ያስፈልጋል። ይሄንን ለማድረግ አንዱ የተጠቀምንበት ያለው DHIS2 የሚባለውን ባለፉት ጊዜያት ከነበረበት 7% አሁን ወደ ደረሰበት 85% እና ከዛ በላይ ማድረስ ችለናል ማለት ነው። ይሄ ትልቅ የሆነ አቺቭመንት ነው። ከዚህ በፊት የነበረው በመረጃዎቻችን የሚመጡት በኤክሴል ነው። አሁን ያንን ወደ ሲስተም እያስገባን ነው ማለት ነው። ሁለተኛው የኢፒኤም የምንለው የኤሌክትሮኒክ ፐብሊክ ሄልዝ ኢመርጀንሲ ማኔጅመንት ትልቁ ሽፍት እሱ ነው። ከፕሪፔርነስ ጀምሮ እስከ አጠቃላይ እስከ መጨረሻው ድረስ ያለውን ኦፕሬሽን እዚህ ውስጥ አስገብተን ነው ማኔጅ የምናደርገው። ለምሳሌ በዚህ ውስጥ የኤምፖክስን በዚህ ነው ማኔጅ ያደረግነው፣ በዚህ ሲስተም ውስጥ ነው ኦፕሬት ያደረግነው። አሁን ያለፈውን የማርበርግ ዲዚዙን በዚህ ሲስተም ነው ማኔጅ ያደረግነው። ሌላውና ሶስተኛው ያው እንግዲህ እኛ የምናገኛቸው ሩመሮች የምናገኛቸው ነገሮች ከሶሻል ሚዲያም ሊሆን ይችላል፣ ከተለያዩ ዓለም ላይ ካሉት ሚዲያዎች ውስጥ በሙሉ መረጃዎቹን ሀንት አድርጎ የሚያመጣልን ሲስተም ነው። ይሄኛው AIOS ይባላል። ይሄ የኢንፎርሜሽን ሲስተም ነው። ኦፕን ከሆኑ ሶርሶች ላይ ኢንፎርሜሽኖችን ጋዘር እያደረገ እያመጣ ለኛ ሬሌቫንት የሆኑትን እየለየን የምንጠቀምበት ማለት ነው። አንድ ሀገር ላይ ሆነ ችግር ሲከሰት ኢሚዲየትሊ እኛ የምንሰማበት ነው። ይሄ ፋይዳው ለምንድን ነው? አንድ እያንዳንዱን ያለንን ዴታ ለውሳኔ ለመስጠት እንጠቀምበታለን። ለውሳኔ ለመስጠት ስንል ለሚከሰቱ በሽታዎች ምላሽ እንሰጥበታለን። አስፈላጊ ነገሩን በየደረጃው ነው ይሄ መደረግ ያለበት፣ በየደረጃው የምናደርገው ይሆናል ማለት ነው። ሌላ ሁለተኛው ይሄን ተንተርሶ የሚያስፈልጉ የጥናት ስራዎች ሊሆኑ ይችላሉ። የሚያስፈልጉ መረጃዎቻችን እዚሁ ፊት ለፊት ላይ ሆነው የሚቀመጡ ይሆናል። ሌላው ሶስተኛው እነዚህን በአንድ ላይ በማምጣት በመቀመርና በመተንተን ለውሳኔ ሰጪዎች ይህን መረጃ እናደርሳለን ማለት ነው። መረጃ ሀብት ነው፣ ዴታ ሀብት ነው። ስለዚህ ዴታዎቻችንን ከታች ጀምሮ ጥራት ባለው መልኩ እንዲመጡ ያደርጋል ማለት ነው። ስለዚህ ጥራት ባለው መልኩ እንዲመጡና አንድ ቦታ እንዲሰባሰቡ ያደርጋል። ይሄ ደግሞ ትልቅ ፋይዳ አለው።
ሪሰንትሊ የጀመርናቸው የዲጂታይዜሽን ኢፈርቶች የህብረተሰብ ጤና አደጋ ቁጥጥርን ከማጠናከር አኳያ ትልቅ ኮንትሪቢዩሽን ወይም አስተዋጽኦ አላቸውና ይሄን እንግዲህ እንደ ፍላግሺፕ ወስደን ባለፉት አመታቶች ሪማርኬብል የሆኑ አቺቭመንቶች መጥተዋል። አንዱ ምንድነው ሁሉም ወረዳዎች እና ሄልዝ ፋሲሊቲዎች ስልጠናውን እንዲያገኙ ማድረግ ነው። ከዛም ባሻገር ደግሞ ሮልአውቱን ወይም DHIS2 ፕላትፎርም ሁሉም ሄልዝ ፋሲሊቲ እና ወረዳ ላይ ኢንስቶል አድርገን በዛ የሰርቬላንስ ዴታ በየሳምንቱ ኢሚዲየትሊ የሆኑትንም ኢቨንቶችን ሪፖርት እንዲያደርጉ ማስቻል ነው።
ይሄ ከሚለውን ፍሬምወርክ ነው ያዘጋጀ ነው። ይህ ማለት እንግዲህ አጠቃላይ ያለውን የሰው ኃይል መረጃ እያያዝን ለማዘመን የምንጠቀምበት ነው። ከዚህ ጋር ተያይዞ እንግዲህ ዲጂታል የሆነ የሰው ኃይል የሰለጠነ የሰው ኃይል መመዝገቢያና መከታተያ ስርዓት ዘርግተናል።
ሌላው ደግሞ ዲጂታላይዝ ስናደርግ ደግሞ የተለያዩ ጭምጭምታዎችንና የጤና ስጋት መረጃዎችን ከተለያዩ ምንጮች እንሰበስባለን። ከዚህ በፊት እነዚህን ደግሞ እነዚህ ስናዘምን ዘመናዊ ቴክኖሎጂ ስናደራጅ አንደኛ ቅልጥፍናን ይጨምራል፣ ውጤታማነትን ይጨምራል። እንዲሁም ደግሞ የምላሽ ስራዎችንም ለምሳሌ ህብረተሰብ ጤና አደጋዎች ሲከሰቱ ቶሎ መረጃዎችን በመተንተን በማረጋገጥ ፈጣን ምላሽ ለመስጠትም ስለሚያስችል በዛ ደረጃ እየሰራን እንገኛለን።
አንዱ የዲጂታላይዜሽን ስራ አንዱ የኢፒኤም ነው እና እንደ ክልል ኢንፋክት ከኢትዮጵያ ህብረተሰብ ጤና ኢንስቲትዩት ጋር ሆነን በቅርብ ነው የጀመርነው። አሁን የካስተማይዜሽን ስራዎችን የፕራክቲስ ስራዎችን እየሰራን ያለ ነው። እስከ ታችኛው መዋቅር ድረስ ካስኬድ ማድረግ አለብን። ኢመርጀንሲዎች ሀፕን ሲያደርጉ ፊዮካችንን አክቲቬት እያደረግን የዝግጅትም ይሁን የምላሽ የመስጠት ስራዎችንም ስናጠናክር የነበረው ኮርዲኔት ስናደርግም የነበረው በዚህ በሪጂናል ፊዮክ ነው።
እንደዚህ ሲስተሞችን ከጀመርን ጊዜ ጀምሮ እንግዲህ የሚታወቅ ከባለፈው እንደ አብነት ብንወስድ 2017 ላይ ወደ 200 አካባቢ ፋሲሊቲዎች ነበሩ ወደኛ ሪፖርት ሲያደርጉ የነበሩት። ይህን ሲስተም ከጀመርን ጊዜ ጀምሮ ግን ወደ 700 ተቋማትን ፐር ዊክ ሪፖርት የሚያደርጉበት ሁኔታ ተፈጥሯል እና ሰኞ ኢንፐርሰን ስራዎች አጠቃላይ የሳምንቱ ስራዎች ይገመግማል። ሮብና አርብ ላይ ደግሞ እንደዚሁ በቨርቹዋሊ ኮሚኒኬት ይደረጋል። አጠቃላይ የሚመጡ የከተማ ውስጥ ያሉ ዳታዎችን በየጊዜው እንትን የሚደረግበት ሁኔታ ነው ያለው። ስለዚህ ኮኦርዲኔሽኑ በዚህ መልኩ የሚሰራ ነው የሚሆነው። ከዚህ በተጨማሪ ግን መልቲ ሴክቶራል በተለይ በዚህ ኮኦርዲኔሽን ውስጥ ሌሎች ሴክተሮችም እንዲሳተፉ አድርገናል።
እንደ ሲዳማ ክልል ፐብሊክ ሄልዝ ኢንስቲትዩት ዲጂታላይዜሽን ላይ ጥሩ ስራዎችን እየሰራን ነው። ከኢትዮጵያ ሕብረተሰብ ጤና ኢንስቲትዩት ጋር በመተባበር መረጃዎች በእጅ ወይም በወረቀት የሚላኩ ሪፖርቶች ነበሩ ከዚህ በፊት። ነገር ግን የራሱ የሆነ ጉድለት የነበረው ሪፖርት ነው ነበሩ ከዚህ በፊት የነበረው። አንደኛ ከጊዜ አንጻርም የዲሊያንስ ችግር ያለበት የኮምፕሊትነስ ችግር ያለበት ነው። አሁን ግን ኢፌም በተለይ ዲኤችኤስ2 ሪፖርት ከመጣ በኋላ አንደኛ ከጊዜ አንጻር በፍጥነት መረጃውን እናገኛለን። መረጃዎቹ ኦልሞስት ኮምፕሊት ናቸው፣ ጥራት ያላቸው መረጃዎች ናቸውና
ወደ 8 አካባቢ የሚሆኑት ሰብሲቲዎች የራሳቸው ሆነ ባሉበት ቦታ ላይ መጠነኛ የሆነ የኤመርጀንሲ ኦፕሬሽን ሴንተር በማዘጋጀት እንዲሰሩ የተደረገበት ሁኔታ ነው ያለው። እያንዳንዱ አይኤምኤሱን ከከተማ ጀምሮ በክፍለ ከተማ ደረጃ በሆስፒታል ደረጃ እስከ ጤና ጣቢያ ደረጃ የሆነ እዚህ የፒዮክ ስትራክቸሩን በማቋቋም በየደረጃው በተወሰነ መልኩ ወጥ በሆነ መልኩ ሪፖርቶች የሚመጡበትና የሚሄዱበትን መንገድ የማመቻቸት ስራ የሰራንበት ነገር ነው።
የድንገተኛ አደጋ ማስተባበሪያ ማዕከል ወይም ፐብሊክ ሄልዝ ኢመርጀንሲ ኦፕሬሽን ሴንተር በሰው ኃይልም በቁሳቁስም በጣም የተደራጀ ነው። ኢንኬዝ ችግሮች ከተፈጠሩ ደግሞ ወዲያው አክቲቬት ተደርጎ ወደ ስራ የሚገባበት ተቋም ነውና
በተለይ ፌም-ዲኤችኤስን ከመጠቀማችን በፊት እንደሚታወቀው በተለይ ዊክ ላይ ዲኤስአር ሪፖርቶችን በሶፍት ኮፒ በኤክሴል ቤዝድ ነው ስንወስድ የነበረው። እነዛ እንግዲህ አንድ ታይም ቴኪንግ ናቸው፣ ታይምሊ ሪፖርቶቹ አይመጡም። ሁለት ደግሞ የሚያስፈልጉ የዳታ ኤሌመንቶች ፕሮፐርሊ ካፕቸር አይደረጉም ነበረ። በተለይ ዲኤችኤስ2 ፌም-ዲኤችኤስ ኢምፕሊመንት ከማድረጋችን በፊት ይሄ የነበረውን የዊክሊ አይዲኤስአር በተለይ በኤክሴል ፎርም ኢምፕሊመንት ስናደርግ የነበረው የተለያዩ ቻሌንጆች ነበሩት። በተለይ የሚፈለጉ ዳታዎች በደንብ አናላይዝ አይደረጉም። ከዳታ ቪዥዋላይዜሽን ጋር ተያይዞ በተለይ ዳሽቦርዶችን ከዳታ አናሊሲስ ጋር ተያይዞ ሚስ ያደርግ ነበረ ያ ሲስተም በፊት።
ሪፖርቶች በኤክሴል እና ማኑዋሊ ነበረ ሪፖርት ሲደረጉ የነበሩት። የሪፖርት ኮምፕሊትነሱ በጣም ችግር ያለበት እና ለዲሲሽን በጣም አስቸጋሪ የነበረ ነገር ነበር የነበረው። ታይምነሱም ጋር የነበረው ችግር ከፍተኛ ነበር። ዴታ ኳሊቲውም ጋር ያለው ችግር በጣም እንትን ነበር። ኮምፕሊትነሱም በዛ ልክ በጣም ችግር ነበር የነበረበት።
ፌም-ዲኤችኤስ2 ወይንም የፌም ስራን በቴክኖሎጂ ማገዝ አንዱ የፈታው ፈጣን የሆነ ኤርሊ ኬዝ ዲቴክሽን፣ ያ ማለት የትኛውም ጉዳይ ቢከሰት ታች ላይ ፈጥነን እንድናቅ እድል ፈጥሯል ማለት ነው። ኤክስ በሚባል ቀበሌ ላይ የሚከሰት እንደምታውቀው ኢትዮጵያ ግዴታ የገባችባቸው ወደ 36 የሚጠጉ የአውትብሬክ ሊስቶች አሉ። በተለይ ደግሞ ወዲያውኑ ሪፖርት የሚደረጉ በሽታዎች እንደ ኮሌራ፣ በሰሞኑ የገጠመ እንደ ማርበርግ አይነትና ፈጣን ምላሽ የሚፈልጉ ጉዳዮችን በፍጥነት መረጃ ወደ ላይ እንዲመጣ አንዱ የፌም በቴክኖሎጂ መታገዙ ዲኤችኤስ2 መጀመራችን ዲጂታላይዝ ማድረጋችን የጠቀመው እሱ ነው። ሁለተኛው ተአማኝነትም የመረጃም ግልጽነት ጥራትንም ላይ አስተዋጽኦ አምጥቷል። እንደምታውቀው ከወረቀት የነበረው ስራ ወደ ቴክኖሎጂ ነው የገባው። ስለዚህ ከዚህ ቀደም በተለይ ፕራይመሪ ሄልዝ ኬር ዩኒት የምንለው ቀበሌና ጤና ኬላ አካባቢ ላይ የሚመጣው መረጃ ከጥራትና ከተአማኝነት አንጻር የነበረውን ጉድለት ፈቶልናል ማለት ነው። ስለዚህ አንዱ ፈጥነን መረጃ እንድናገኝ አድርጓል። ሌላው ደግሞ የሚመጣውን መረጃ ተአማኝ እንዲሆን እድል ፈጥሯል ማለት ነው።
የመረጃ ልውውጥ ዘዴ ወይም ዲኤችኤስ2 አሁን በአገር ደረጃ ያለውን እሱን እየተጠቀምን ነው። ጥሩ አፈጻጸም ነው ያለው። አዲስ ስለሆነ የተለያዩ ችግሮች አሉ። እነዛን ችግሮች በድጋፋዊ ጉብኝት እዚሁ ከማዕከል ሆኖ በስልክም በኢሜይልም በተለያዩ በቱሉ በዚሁ በዲጂታል ቴክኖሎጂ እየተጠቀምን በጣም ከፍ እያለ አፈጻጸማቸው ወደ 70% ደረጃ እያለፈ ነው።
ከሌሎች ሴክተር መስሪያ ቤቶች ጋር በጋራ በመስራት ይህንን ማዕከል የጤና መረጃ ስራዎቻችንን ደግሞ በጣም በማዘመን የባለሙያዎቻችንን ክህሎት ዋናው ግብአታችን ባለሙያችን ነው። ባለሙያዎቻችንን ደግሞ ክህሎታቸውን እንዲጨምር ያንን በማሻሻል የአደጋ ምላሽና አሰጣጥ አስተዳደሩን ደግሞ የበለጠ በማቀናጀት የልዕቀት ማዕከል በማድረግ በተለይ የፌማችንን ሴንተር ኦፍ ኤክሰለንስ ለማድረግ ትልቅ ስራ እየተሰራ ይገኛል። የጤና ሚኒስቴርም ከኢንስቲትዩቱ ጋር አብሮ በመሆን ባለፈው ዓመት በይፋ ይህንን አስጀምሮ ይህንን እያገዘ ይገኛል ማለት ነው።
ይሄ እንግዲህ በጣም ትልቅ ኢኒሼቲቭ ይዘን እየሰራንበት ያለ ነው። ከኮሚኒቲ የሚነሱ ስራዎችን እንዴት ነው መስራት ያለብን ከማህበረሰቡ ጋር የሚለውን የቅኝት ስራዎቻችን እንዴት ነው መስራት ያለባቸው የሚሉትን ዶክመንቶች ሰፋ ያሉ ሰርተናል። የሰው ኃይላችን እንዴት ነው ማኔጅ የምናደርገው አንዱ ዶክመንትና ፖሊሲና ፕሮሲጀርስ ላይ የምንሰራቸው የሊደርሺፕ ላይ የምንሰራቸው ስራዎች ናቸው። ሌላ ሁለተኛ ወርክ ፎርሳችን ላይ ነው። አጠቃላይ የፐብሊክ ሄልዝ ኢመርጀንሲ ላይ ሊሆን የሚችለውን የሰው ኃይላችንን መተንበይ ያለውን ነገር ፎሎ ማድረግ በካፓሲቲ ቢውልድ እንዲያደርጉ ማድረግ ነው። ለዚህ ብዙ ስራዎች እየሰራን ነው እዚህም ላይ። ሌላው ሰስተነብል የሆነ ፋይናንስ ለኢመርጀንሲ መኖር አለበት የሚሉ ነገሮች ናቸው። ስለዚህ የሴንተር ኦፍ ኤክሰለንስ የልቀት ማዕከል የመሆን ሂደታችን በዚህ ላይ ነው ያለው። በጥሩ ፕሮግረስ ላይ ነው ያለው።
Let me begin by congratulating Ethiopia for its strong leadership and unwavering commitment in advancing this bold and visionary agenda, the PHEM-Center of Excellence initiative.
ማንኛውም የህብረተሰብ ጤና አደጋዎች እንግዲህ ከመከሰታቸው በፊት በ24 ሰዓት ውስጥ ቦታው ላይ መድረስና ምላሽ መስጠት የሚችሉ ባለሙያዎችን ብቁ የሆኑ ባለሙያዎችን በማፍራት ላይ እንገኛለን። ይሄ ማለት በየደረጃው ከጤና ተቋም ደረጃ ጀምሮ እስከ ላይ ድረስ ያሉ ባለሙያዎችን ብቁ ለማድረግ የሚሰሩ ስራዎች አሉ። ከነዚህ ውስጥ አንዱ የ3 ወር ፊልድ ኢፒዲሚዮሎጂ ትሬኒንግ ፕሮግራም ነው። ይሄንን እንግዲህ በሀገሪቱ በሚገኙ ሁሉም ወረዳዎች ላይ ለማዳረስ እየሞከርን ነው። ቢያንስ አንድ የሰለጠነ የጤና ባለሙያ በወረዳዎች ላይ እንዲኖሩ አድርገናል። በዚህም እንግዲህ እስካሁን ድረስ ወደ 1500 የሚጠጉ ባለሙያዎችን ማሰልጠን ችለናል ማለት ነው። ሌላው የኢመርጀንሲ ሜዲካል ቲም ወይም የድንገተኛ ሕክምና ቡድን ነው። እሱን እንግዲህ በአፍሪካው በሲቪል የመጀመሪያው የሆነውን ሰርቲፋይ ለማስደረግ በዝግጅት ላይ እንገኛለን።
እያንዳንዱ ቀበሌ እያንዳንዱ ወረዳ ያለበትን የዝግጁነት ሁኔታ መለየት ያለበትን የችግሮችን ሁኔታ ማየት ምን ሊከሰት ይችላል የሚለውን በየወረዳዎቹ ቼክ የማድረግ ስራዎች ይሰራሉ። ለዛ የሚያስፈልጉት ነገሮች የማሰልጠን አስፈላጊውን ክትትል የማድረግ ስራዎች ይሰራሉ። አጠቃላይ ማህበረሰቡ በቅድሚያ ላይ ያደረጋቸው የሚያስፈልጉትን ጥንቃቄዎች ችግሮች ሲከሰቱ እንዴት ነው የቅኝት ስራዎች የሚሰሩት ለማህበረሰቡ አስፈላጊውን የሆነ መረጃ መስጠት ስራዎች ይሰራሉ። ለነዚህ አስፈላጊውን የሆኑ ክትትሎች እናደርጋለን።
This milestone demonstrates that sustainable investment in preparedness yield tangible results. Ethiopia's experience, including its recent Marburg virus disease response, shows that strengthened systems deliver real returns during crisis. Ethiopia is setting a practical example of how strategic investments, digital transformation, innovation, and strong leadership translates into resilience. This platform, therefore, is strengthening national capacity and emerging as a continental hub for learning, exchange, and regional collaboration across Africa and beyond, contributing meaningfully to global health security and making this world a safer place to live in.
አገራችን በተለይ በዲጂታልና በበሽታ መከላከልና መቆጣጠር ስርዓት ለእኛ ብቻ ሳይሆን ለአፍሪካም ለሌሎችም ሀገር ምሳሌ ሆና የምትወጣበት ስራ እንዲኖር ከዚህ ቀጥሎ እንሰራለን። በዚህ አጋጣሚ እንግዲህ ክቡር ጠቅላይ ሚኒስትር ዶክተር አብይ አህመድ የአፍሪካ የዲጂታል ጤናና የአርቲፊሻል ኢንተለጀንስ በጤናው ዘርፍ ማለት ነው እንግዲህ ሻምፒዮን ተደርገው አሁን በጨረስነው አፍሪካ ህብረት ጉባኤ ላይ እንግዲህ ጸድቋል ማለት ነው የእሳቸው ሻምፒዮን ሆነው። በዚህም እንግዲህ ለጤናው ዘርፍ ትልቅ ትርጉም አለ። ይሄ ትልቅም ምርታ ይዞ የሚመጣ ነገር ነው። በጋራ ብዙ ነገሮችን እንሰራለን።
በወረርሽኝ መልክ የሚከሰቱ በሽታዎችን፣ የጤና ክስተቶችንና የአካባቢ ጤና ችግሮችን አስቀድመው በመለየትና ምላሽ በመስጠት ረገድ የሀገሪቱ የጤና ደህንነት ምሰሶ ሆኖ እያገለገለ ይገኛል።
That was impressive. Give it up for yourselves one more time. This is what happens when there is commitment, leadership, and strategy. And of course, more than all, when there are people who are here to implement and to make it happen. Indeed, this is a center of excellence. So, great. We've watched the video. And how was the journey like? What was the progress like? Let's get a presentation. This is going to be the final one, actually. So let's invite Dr. Melkamu Abbate, Deputy Director General of EPHI, to give us a presentation of how this journey took place and what it was like. Let's put our hands together for Dr. Melkamu.
Thank you so much. Good afternoon. I will be very brief. So it is just to show you that you have such an experience on the booth, on the keynote speeches, and on the other, on the conversations that you have. But to have a comprehensive and consolidated view, I will have a very brief presentation. So I am going to start my presentation by this quote that the minister has made last year on the launching of the Public Health Emergency Management Center of Excellence initiative. It says the work we do for public health emergency preparedness is mandatory and critical. In the very fabric of which we should be in health and emergency response. So, the presentations that I'm going to make, you need to have this. So this is the mission and the vision that we already shared, and you have on the strategy, which is distributed for you all. This is a new technology, and I'm not. So, as to the pillars of the Center of Excellence, one is having this guiding documents for the Center of Excellence. So these are the guiding documents that we have launched earlier this today. The PHEM-Center of Excellence framework, the FEOC strategic plan, the EPHI surveillance strategy, border security strategic plan, risk communication and community engagement, the EHEC framework, which is actually adapted from the GHEC one, and the FEOC handbook, which was an old version, and now we have developed a new one by customizing what is coming now. So the digitization aspect and the other developments in the world. And the last one is this community-level public health emergency management. This is one thing. We have developed this because of the fact that Ethiopia is highly known by this health extension program. The problem with that health extension program is it missed the link between this public health emergency and health extension workers. So even there is no emergency modules there. So these are the basic pointers to be addressed in this guideline. So the next one is the digitalization one. This is the second pillar. So this is I can say that the date is this day is actually dedicated for this digitization aspects. DHIS2, PHEM, EIOS, and the PHEM Insight for organized public health emergency evidences. This is just to show you the digital transformation, how it looks like, starting from prior 2008. This was paper-based. And then the DHIS2 initiative has been started in 2018. The pilot was in different regions. And then in 2019 to 2020, it is integrated as an app into the MOH DHIS2 instance. And then in 2022 up to 2023, the PHEM DHIS2 instance is customized. Capacity building has been given. Till then, the coverage is only 7%, and more in towns like Addis, Redwa, and Harar. Then, in 2024, we have revitalized with different efforts, and we were able to make it 24%. Then in 2025, we have done different activities like system enhancement, and it reaches about 72 to 85%. The current one is 85%. So we made it from 7% to 85%. Even to compare it with, yes. Thank you so much. So why we are able to reach this much 85% is because of one is the leadership engagement. The minister, as you have seen in the morning, Dr. Masai, the Director General, and all the management members and the team members from EPHI, and the Regional Health Bureau, and also the Regional Public Health Institutes, all are highly engaged on making this. So the previous upload has to go to this leadership. So when we see the impact, you can look at in the different aspects on the clinics, health centers, health posts, and hospitals. I will not go through all of them. And so we are saying that we are using PHEM. The thing is how it transforms from the manual to that of integrating all the operations and making it to be effective on this responding to different outbreaks. That one is on the manual PHEM operation, and this one is on the integrated digital system, and we have used it for MPOX and MVD management. So this is the PHEM implementation. We have started in February 2025 with a national TOT of 30 national staffs. And then in April 2025, we were able to have this Serval, the cloud system. And we have advanced this, and in 2025 up to now. So I'm mentioning this 2025 repeatedly because of the fact that it is a milestone where we transform this public health emergency management. We have launched this Center of Excellence and the different initiatives. This is the AIOS. You have seen the achievements that we made, and this is one of the points where we have this subnational EIOS. This commenced in WHO's newsletter. You can get the link and you can see it. Here is a point: how we are going to integrate all those things. This data, the different activities, will start at the community and then at the health facility. You all know that most of our population will come to health facility when they feel sick. So the second point will be the health facilities that will get different data, and then the already health facility. So this all will come together at PHEM-DHIS2. And the point of entry data, so these all are integrated and coming together with this PHEM, the Electronic Public Health Emergency Management. So we are saying that there are different platforms, so unless we integrate them, the result will be fatal. This is the Health Emergency Workforce Information System. This is trackable roster. Actually, there is a workforce part at the PHEM, but this one is a very different one to know all the workforces that we have in the country. So this is trackable with different, the addresses, the training, the profession, and all the experiences. The other point that we have inaugurated this morning is the Emergency Operations Center. This shows how the evolution of this Emergency Public Health Operations Center goes through. So it has been started in 2017, and then in 2024 to 2025, you have seen what we have reached today. This is an important one. This is to manage different outbreaks. The mobility is critical. This is the population mobility mapping, which we have done in 2025, and this is the first in the country. This is for the first time we're able to make this population movement, internal population movement, and the movement from outside to the country. So by using this digital map, we're able to manage MPOX and MVD. We have practically demonstrated to manage this. So on the routes, we put screening points. So this is the first, and it is really transformed how we see and how we manage the public health emergencies. The other is workforce. On the workforce, it has been stated. I will not go through much of this. This the field epidemiology training. We have this emergency medical teams. So the team has responded in different outbreaks, conflict, and we are able to host the global full-scale functional exercise, the simulation exercise. This is also done in 2025. So people who have this expertise around the world had come here in Ethiopia, and we were able to demonstrate it on the ground. And the other one is we are preparing to host the AMT's global meeting in 2026. That is going to happen in November. We are making the necessary preparations for this. The other is this rapid response teams. These rapid response teams are designed in a way that they are going to respond to any kind of outbreaks, infectious and non-infectious one. And also it is multisectoral and multidisciplinary by nature. That is, you can mention the AVOC surge training. This is the Ethiopian Health Emergency Corpus. This is adapted and adopted from the GHEC, that is the Global Health Emergency Corps. It has different tiers: the public health workforce, the emergency workforce, the surge capacity, and connect leadership. There are different pillars. It is distributed, and you can look at it. So this is important, not only to having a document, but our intervention on the workforce has to be based on the tier system. So for the tier 1, there is a specific intervention, tier 2, tier 3, and it will go higher. This is a community film. As you all know, all emergencies, all outbreaks started in the community and end in the community. And people are saying resilience started in the community and it ends in the community. So based on this principle, we have now the community public health emergency management. For this, we had so many experiences. As I mentioned, the health extension program is really grounded on that. So we are making this public health emergency aspect to be embedded with the health extension program. This is the emergency supply chain management. You have seen it in the booth, and the evolution starting from pre-2009 up to that of 2024. We have now integrated into PHEM and DHIS2 tracker, targeted preparedness and logistics support, and also real-time tracking, resource mapping, and all those things are done under this supply chain. So this is the system, how it works. So these all are the pathways. These all are the processes. The digital activities are tools. So what is the impact that we have while doing these all activities? By this, as compared to 2026 up to that of 2025, 717 is a real indicator which shows the impact that we are making by using all these activities. So the proportion of events detected within 7 days is increased. The proportion of events notified within a day is also shows progression, and also the proportion of events with early response actions within 7 days is also shows an improvement. So even in this epoch and that of MVD, which had happened last several months, we are able to use this 717. And the other is the Ethiopian NAMS implementation progress. This is a comprehensive one, and we look this based on the JE in 2016 and that of 2025. There is an increment on different levels, starting from the prevent pillar, detect and respond pillars. So this shows not only the capacity. We are talking about not only the capacity, but also the capability to do it. The capability to respond, the capability to detect. We are able to build all those pillars. And this is the SPAR report. And this SPAR report, as compared to 2024 and 2025, it shows an improvement as you have seen. So this is the final one. What is expected from all of us to move forward? One we are going to do is we'll form a technical working group from governmental and non-governmental and also from line ministries to make these technical working groups functional. And the other is we'll move on this collaborative surveillance. Our surveillance strategy basically directed on this, but we need to work closely with other sectors to make this happen. So this is going to be done through the One Health approach that we are actually following, and EPHI is mandated to be a One Health coordinating unit and a secretariat. This has been happened, and will make this collaborative surveillance to move like this. And the third point that we need to work on is on the innovative financing approach. When we have different outbreaks, we are moving to search for money. We are moving to mobilize different resources, including supplies. So we need to move toward this self-reliance. This is the basic principle of the country, and we in the health sector as well, we are following this kind of approaches. So we need to work on that. So we are hearing that the world is favoring now the public health emergency aspect, even though the landscape in the world is changing. So what does that mean? What does that mean for the public health emergency management? What can we do with that? We need to talk, we need to explore, and we need to work on this in a very structured one. The last one is, we made a huge investment, and also much is left. I hope you heard the minister in the morning. She expressed that we made so many progresses. We are delivering all the activities, but the gap is there. So we need all of you to invest technically and financially to make these activities to be realized. Thank you so much.
Thank you very much, Dr. Melkamu, Deputy Director General of EPHI. That was a very detailed and comprehensive, articulate presentation. Thank you for that. Okay, so when we have something to celebrate, it's very customary to cut cake together, right? We do it at birthdays, we do it on anniversaries, parties, and why not doing it when we celebrate this milestone today? So I'll invite the guests in a little bit, but what have we done so far? Today has been a very critical day, very packed as well with different activities and different presentations. So we talked about how Ethiopia is evolving from fragmented data to unified intelligence and from isolated action to seamless national coordination. We've seen that through different activities. The digital transformation is central to modern emergency management, and that we witnessed that through the renovated FIOC represents, the renovated FIOC represents operational readiness, and Her Excellency also, guest of honors, inaugurated that today, the renovated center, and we also saw how the Center of Excellence came to be, because we've watched it in the presentation and in the documentary, what has been done so far. You have the documents with you, the guidelines and the frameworks. And we also, through the handover, we witnessed regional empowerment through ICT strengthen national resilience, modernization, and regional leadership, how critical that is. And now it's easier, the work. I've never thought the Ministry of Health and any health work is easy, but today it also showed me how much intense your works have been. I am not in the health center, in the health sector, but I see how complicated your works are and how much hard work you put in it. My appreciation for you people in the health sector has increased tremendously. So thank you for your service. And also now I will see more and more excellence coming from this sector, because that's what we've been talking about, the Center of Excellence. And we will celebrate more and more milestones very soon. So to cut the cake, let me invite Dr. Mesai, Director General of EPHI, Dr. Melkamu, Deputy Director General of EPHI, Your Excellency Professor Francis Casolo from WHO, and Regional Health Bureau heads. Please come join our guests, our guest of honor, and also Director Generals of EPHI. The other Director Generals, please come join. Let's celebrate this milestone. And Regional Public Health Directors, heads, please come join on the stage. Let's cut the cake. Let's celebrate this milestone one more time. Oh. እሺ እንኳን ደስ ያላችሁ ለይሄንን ሴንተር ኦፍ ኤክሰለንስ ለማስመረቅ ስለበቃችሁ ለዚህ ሁሉ ስራችሁ እንግዲህ ሁላችንም እንኳን ደስ ያላችሁ እንላለን። እባካችሁ አጨብጭቡላቸው፣ ሞቅ አርጋችሁ ያጨበጨባችሁ። Your Excellency and also Dr. Mesai, please cut the cake. አንዴ ግሩፕ ፎቶ አንዴ በህብረት ፎቶ ተነሱና ካሜራማኑ አንዴ ያገኘው ይሄንን ፎቶ።
ሁላችሁንም በኢትዮጵያ ሕብረተሰብ ጤና ኢንስቲትዩትና በራሴ ስም እጅግ አድርጌ አመሰግናለሁ። የዛሬው ፕሮግራም በይፋ ማብቃቱን አበስራለሁ። አመሰግናለሁ።
በጣም እናመሰግናለን Dr. Masai. Thank you very much. So before we go to lunch, let's enjoy one more round of music from our beloved Zema string group. So let's enjoy. ስለመጣችሁ ሁላችሁንም እናመሰግናለን. Thank you. እንግዶቻችን ምሳ የተዘጋጀ ስለሆነ እባካችሁ አብረን ምሳ በልተን እንለያይ። Your Excellencies, distinguished guests and ladies and gentlemen, we have lunch together before we leave, so please our ushers will take you to that lunch area. Thank you.